Good day. We are going to discuss about ethical aspect of gerontological nursing. Objectives. After reading this chapter, you should be able to discuss various philosophies regarding right and wrong, describe ethical standards, principles, and cultural considerations guiding nursing practice, list factors that have increased ethical dilemmas for nurses, and identify measures to help nurses make ethical decisions. So these are the topic outlines that will be discussed later on. So philosophical guiding ethical thinking. So ethics. The word ethics is originated in ancient Greece. So ethos means those beliefs that guide life. So most current definition of ethics revolve around the concept of accepted standards of conduct and moral judgment. So basically, itong ethics is tumutulong siya in determining the right and wrong courses of action. So there are some philosophies naman that influencing ethical decision making or that disagree about what constitutes to right and wrong. So this includes the utilitarianism. So this philosophy holds that good acts are those from which the greatest number of people will benefit and gain happiness. Egoism naman is opposite siya of the utilitarianism. So egoism proposes that an act is morally acceptable if it is of the greatest benefit to oneself, and that there is no reason to perform an act that benefit others unless one will personally benefit from it as well. So yan, greatest benefit to oneself. So kung ano lang yung nakaka-benefit sa kanya, yun lang. Hindi siya unlike sa kung ano yung nakaka-benefit or nakakagain ng happiness sa nakakarami. Hindi, yung sa egoism is greatest benefit lang siya to oneself. Yan. Then relativism, this philosophy can be referred to as situational ethics, in the right and wrong are relative to the situation. So within the relativism are several subgroups of thinking. So there are some may mga activists na naniniwala that there can be individual variation sa kung ano yung ethically correct. So whereas yung other yung iba naman is they feel that yung paniniwala of an individual should conform to the overall belief of the society for the given time and situation. So then next is the absolutism. So under the theory of absolutism, there are specific truths to guide action. So the truths can vary depending on a person's belief. So for example nito is yung Christian's view. So pwedeng iba siya from the atheist view or yung sa mga Muslims view on certain moral behavior. And yung in a person who supports a political view of democracy may believe in truths different from those of a communist. So para illustrate yung application of these four different philosophies, yung utilitarianism, egoism, relativism, and absolutism, there are considered the hypothetical situation of friends or yung mga kaibigan na who shares the same apartment na lang. So one day is that merong itong mga ko na to is may na-receive silang certificates. So habang tinitingnan nila yun, yung certificate na yun, I mean, meron siyang reward na thousands. So ethically, sa kanya ba yung pwede niya bang kunin or pwede niya bang angkinin yung certificate na nakuha nung kasama niya sa apartment? So yung utilitarian, magpropose siya na hatiin na lang yung reward na nakuha niya sa mga kasama niya that will bring them the greatest happiness or the greatest number of people. So ayan, then yung egoist naman is mag-encourage siya na ipatago na lang yung panalo or yung reward dahil yun yung makakabuti sa kanya personally. Then yung relativist naman might say na itago na lang din yung panalo kasi dito in this situation he will give more money than he will need, di ba? Then i-share niya yung kung ano yung meron siya or ano yung naipanalo niya. Then yung absolutist naman who happens halimbawa Christian yung kanila na pwede lang sabihin na yung reward na yun is morally yung nakuha nilang certificate is morally wrong kung hindi naman sa kanila. So yung effort should be made to find the rightful owner. So pag halimbawa hindi mo dapat kukunin kasi syempre yun yung belief na meron yung halimbawa sa Christian. Ayun. So next is ethics in nursing. So external and internal ethical standards. Professions such as nursing require a code of ethics on which practice can be based and evaluated. A professional code of ethics is accepted by those who practice the profession as the formal guidelines for their action. For example, is the American Nurses Association Code of Ethics for nurses offers ethics that outline the broad values of the profession. Then the American Holistic Nurses Associated has developed the Code of Ethics for holistic nursing that provide guidance for nurses' action and responsibilities for self, others, and environments. So, according sa NA, Center for Ethics and Human Rights, was established itong Code of Ethics para makatulong sa mga nurses to navigate the ethical and value conflict and life and death decision. So in many of which are the common to everyday practice. So, importante sa mga nurses na maintindihan nila yung values nila dahil pwedeng magresulta ito ng conflict and stress kapag yung values of nurses is magkaiba from those serve the employer and the population. Then, ethical principle, beneficence to do good for patient. So, this principle is based on the belief that education and experience of nurses enable them to make sound decisions that serve patient's best interest. So, ito yung type of principle or a principle that enjoin us not only to bring about kung ano yung mga kabuti for the others, but also para makatulong sa kanila for their to help them better their condition with respect to virtue, intelligence, or comfort. So this duty, yung duty nitong beneficence is it requires the provision of benefits and balancing of benefits and for all the people concerned in the given circumstances. Then next is the non-maleficence. So to prevent harm to patient. So this principle could be viewed as a subset of beneficence because the intent is ultimately to take action that is good for patient. So non-maleficence requires nurses to act in such a way na maka-avoid sila of causing harm on the patient or the client. So in situation na it requiring nursing action. So ito principle na to also addresses the needs to avoid harm regardless of reason for negative action. So yung mga nurses should act with empathy without bad faith or ill will nor make a false accusation. So prevent your to harm patient physically, mentally, or psychological, social, financial, spiritual, or etc. Yun, ganun. So basically, it is a negative action. So ayan, duty of the non-maleficent is we ought to avoid the inflicting evil, injury, or harm upon others as we would avoid doing so to ourselves, diba? Then we ought to prevent evil or harm which encompasses the pain, suffering, disability, and death of patient. So ayan. The next is justice. So justice, to be fair, treat people equally, and give the patient the service they need. And the foundation of this principle is the belief that patients are entitled to service based on needs, regardless of the ability to pay. I mean. Then so yung duty of the justice is to arouse the stresses, the proper distribution of social benefits and burdens. So hindi lang siya we enjoy not only should we enjoy the social benefits with others, but we should also equally share with them the burdens of social living. So yung duty ng justice is it demands on the fairness for everyone. So yeah. Then next is the fidelity and veracity. So fidelity means to respect our words and duty to patient. Then veracity naman means truthfulness. So this principle is central to all nurses-patient interaction because the quality of this relationship depends on the trust and integrity, fullness to trust and promise. So duty of this is we should be faithful to our duties, obligations, vows, and or especially sa pledges. Kasi when it comes to hindi lang siya dapat fidelity, diba? So respect our words and duty to patient. So yung pledge na binibigay sa atin or yung nire-recite natin, dapat hindi lang siya words na sinasabi, kundi sinasapuso rin natin yun. Kasi that is yung pledge na nag-promise tayo to do not harm to our patient, to do no harm to our patient. So this likewise refers to one's loyalty to a worthy cause. So telling the truth as the situation demands it, and keeping actual and implicit, as I said, implicit promises. So diba? Hindi siya nagre-represent of a fiction as truth. So, ayan. So, next is autonomy. To respect patients' freedom, preferences, and rights. So, ensuring and protecting older patients' right to provide informed consent and consistent with this principle. So, itong autonomy is a request for an early death, diba? If there is a consent. So, maybe an attempt of the patient to regain control, whether only in deciding kung kailan sila mamatay, or it is the practicing of the right to die. The next is confidentiality, to respect the privacy of patient. So patient often share highly personal information with nurses and need to feel assured that their trust will not be violated. So in addition to respecting confidentiality as being morally sound principle, yung Health Insurance Portability and Accountability Act and other laws have afforded people the legal right to privacy, and consequences in this is violated. So there are few nurses that would argue with the value of this principle kasi in fact these practices that reinforce this principle are widely promoted, such as yung pag-ensure that the patient is receiving the care na kailangan nila and respecting the rights of the patient to consent or deny the consent for treatment. So yun may karapatan sila na magbigay ng consent or mag-deny ng consent for their own treatment, and then preventing incompetent staff from caring for patient, and the following acceptable standards of practice. So the cultural consideration, an issue that must be considered in nursing practice is that what may be considered an ethical practice for some individuals may not be viewed as such by others due to their cultural backgrounds. For instance, A nurse may be a white Protestant woman born in the United States who holds the benefit shield in the bulleted list below the below. The nurses may view this as sound ethical beliefs and allow them to guide her practice. Although these beliefs could be acceptable and appreciated by many individuals, they could conflict with the benefits of others. So, for example, are the following. So, first is the belief that individuals have the right to make their own decision regardless of their sex and should be empowered to do so. So, in many Amish, German, Greek, or Haitian, Irish, and Puerto Rican families, yung the individuals discusses important decisions with their family members and mas preferred nila na to have the family involved in the decision they're going to make. So, but in Jewish individuals, they may seek the advice of rabbi. So, there are some people naman na may not want to discuss issues or and confront decision making. So, there are, for instance, Filipinos and Japanese view discussion of that as a taboo. So, next is the women are equal to men. So, in Arabs, Iranian, Hindu, and some Italian families, so common for them or common for males to have assumed decision making roles. So, mas common na dito yung mga nagde-decision is yung mga male over women, and women may yield their decision making authority to them. The next is prayer is beneficial supplement to medical treatment. So, hindi lahat ng prayer may not be welcome by patients who are agnostic or atheistic. So, even among persons who do believe in prayer, there may be differences in their deity worship and methods of praying. So, like for the Islam, so meron silang sinusundan or meron silang yung direction na sinusundan for their praying, and meron mga bawal na nilang gawin when praying. Ganun. Then, next is the people have the right to have the confidentiality of their health information protected even from relatives. So, dito is to individuals who view family involvement in decision making as tinitingnan as natural and preferable. So, there may be a desire to have health information shared with their family. So, yung nila, hindi lang siya yung confidentiality or yung information about their health is that mas prefer nila na alam ng family or ma-share din sa family. So, ayan. So, syempre, for the role of nurses, so need natin na i-appreciate yung mga ethical issues that influences or influenced by culture. So, syempre, as a nurse, hindi lang tayo, we don't just care for the patient, but learning about the patient's culture and preference based on it are essential to assuring action. So, do not inadvertently produce ethical conflicts. So, syempre, merong mga culture na kailangan natin talaga malaman yung culture. Kasi meron tayong iba't ibang culture. So, yung nito is, halimbawa, sa Islam, bawal pala yung ganito, bawal silang kumain. So, dapat alam mo kung ano yung mga pwede at bawal sa kanila. So, it is also important na for the nurses na maalala nila na hindi lahat ng individual is same yung pinagmulan nila ng or same yung cultural group nila. So, o yung mga beliefs and practices, as I said kanina, yung mga yan. Then, which further enforce the importance of learning about the individual's preference, kung ano yung mas preferred nila. So, gerontological nurses. So, nursing practice involved any situation that could produce conflicts between nurses' values and external system affecting their decision, and conflict between the rights of patient and nurses' responsibilities to those patients. So madali lang nasabihin na yung mga nurses is laging pumafollow ng mga regulations, mag-adhere ng mga principles, and ginagawa yung kung ano yung nakakabuti sa patient. Pero 100% ba na yung mga nurses is they can realistically be expected to follow those guidelines? Siyempre, hindi. Kasi there are some na, although we have rules and regulations, so hindi sa lahat ng oras is napafollow yun ng mga nurses. So what if the following rules means they may lose the income of which their families depend, violate the rights of individual to decide their own destinies, or creating problems for their co-workers, or mag-post ng so syempre there are instances na may mga mababiolate ka talagang rights. So kung it would harm your patient or your co-worker, syempre there are may mga instances na pwede kang mabiolate, or yung may mabiolate ka na regulation or law na makaka-harm doon sa ginawa mo. So yan. So
Just increasing dilemmas for nurses. So, question of ethics are not new to nursing. However, changes the profession and the entire healthcare delivery system have introduced new areas of ethical dilemmas to nursing practice. So, expanded role of nurses. So, nurses have gone beyond the confines of simple following doctor orders and providing basic comfort and care. They now perform sophisticated assessment, diagnose nursing problems, monitor and give complicated treatments, use alternative uh, modalities of care, and particularly in ger- geriatric care setting, increasingly make independent judgment about patient clinical conditions. This wide scope of function, combines with higher salaries and greater status, has increased the accountability and responsibility of nurses to the care of patients. So, medical technology. Artificial organs, genetic screening, new drugs, computers, lasers, ultrasounds, and other innovation have increased the medical community's ability to diagnose and treat problems to save lives that once would have been given no hope. However, new problems have accomplished these advances such as determining on whom, when, and how this technology should be used. Next is uh, new fiscal constraints. So in the past, the major concern of healthcare providers and agencies was to provide quality services to help people maintain and restore health now. Uh, Now there are competing and sometimes overriding concerns, including the following: being cost effective, minimizing bad debts, and developing alternate source of revenue. Patients needs a wedge against economic survival, resulting in some difficulties decision. Further, in this era of ration care and scarce resources, question arise regarding the rights of older adults to expect a high quality and quantity of health and social services while other groups lack basic assistance. Conflict of interest. Nurses can face a variety of situations that present a conflict of interest. Example of this could include the following. A nurse believes a resident's life could be extended with nasogastric feeding and antibiotic therapy feeding. That a resident and family rejected of this care is inappropriate. A patient physical therapy discontinued due to insurance restrictions and the nurse knowing that the patient has the potential to make continual progress with the therapy, and the nurse knowing the employer is intentionally keeping staffing level below what is needed but not objecting or advocating for proper staffing because the nurse does not want to jeopardize his or her position. So, next is greater number of older adults. So, entitlement program and services for older person had less impact when only a small portion of the population was old. But with growing numbers of people spending more years in old age and the increasing ratio of dependent individuals to productive workers, society is begin to feel burdened. So, assisted suicide. The ANA has been cleared in its objective to assist suicide, believing instead that nurses should provide competent, compassionate, and end-of-life care. However, although participating in a patient-assisted suicide is unethical and inappropriate, nurses may care for terminally ill individuals who accept and desire assisted suicide. So we have here the measures to help nurses make ethical decisions. So although guidelines exist, no solid answer can resolve all of the ethical dilemma that nurses face. Nurses should, however, minimize their struggles in making ethical decisions by using critical thinking and employing the following measures. So we have here the encourage patient to express their desires, advise patient to express their desire in advance directives, wills, and other legally binding documents, and advocates compliance with patient's wishes. Next, identify significant others who impact and are impacted. Considered family members, friends, and caregivers who are involved with the patient and the situation and their concern and preferences. Be sure to help nurses make ethical decisions. So, know yourself or knowing yourself. The nurse should review his or her personal value system, the influences of religion, cultural beliefs, and personal experiences should be explored to understand one's unique comfort zone with specific ethical issues. So, one of the example here is the Muslim patients. So, next is read. Review the medical in literature for discussions and case experiences of other nurses to gain a wider perspective into the type of ethical problems confronted within nursing and strategies for managing them. Literature outside the field of nursing can help add new facet to one's thinking. Next is discuss. Informal education programs of informal coffee breaks talk about issues with other healthy members. And here we have also the measures to help nurses make ethical decisions. So form an ethical committee. So bring together various members of the health team, clergy, attorney, and lay persons to study ethical problem within the specific care setting, clarify legal and regulatory boundaries, develop policies, discuss ethical problems that surface, and investigate charges of ethical misconducts. Also, consult. Clinical ethics consultation takes the form of an ethical committee or consultation provided by expert individuals or group, for example, lawyers, philosophers, and clinicians who specialize in bioethics. Next is share. When faced with a difficult ethical decision, talk with others and seek guidance and support. So, hindi ka pwedeng magsarili lang, hindi mo i-share sa iba kung ano yung iniisip mo. Kung gusto mo ng guidance or anything, talk to someone who has experience already or ganito, ganyan. Then evaluate decisions, assess the outcomes of the actions and whether the same sources of action would be chosen in a similar situation in the future. Even the worst decision holds some lessons, of course. So, services in the continuum of care for older adults, supportive and preventive services. So, nurses are challenged to help older adults maintain independence, prevent risk to health and well-being, establish meaningful lifestyle, and develop self-care strategies for health and medical needs. Supportive and preventive service support independent individual in maintenance in maintaining their self-care capacity so that they can avoid physical, emotional, social, and spiritual problem in this category of service. Nurses must likely will be involved with the following. First is identifying service need, um, referring older adults to appropriate service, then supporting and coordinating services. For example, examples of supporting and preventive services for community-based older adults are described below. So, financial services, employment, nutrition, housing, healthcare, social support and activities, volunteer work, education, counseling, consumer affairs, legal and tax services, transportation, personal emergency response systems, shopping at home. So, for the potential and intermittent care services, it provides assistance to individuals with a partial limitation in self-care capacity or therapeutic demand that requires occasional assistance. First is assistance with chores, home-delivered meals, home monitoring, telephone reassurance, home health care, foster care, and group homes. We also have here adult day services, day treatment and day hospital programs, assisted living, respite care, health ministry and parish nurse program, care and case management, program of all inclusive care for the elderly, hospice, then hospital care. So complete and continuous care services is hospital care. So hospital care for older persons may require when diagnostic procedure and therapeutic action indicates a need for specialized technologies or frequent monitoring. Older adults can be patient or virtually all acute hospital services except of course pediatric and obstetric, and here they may be encountered as relatively of for the primary patients. Nursing homes. Nursing homes provide 24-hour supervision and nursing care to patients who are unable to be cared for in the community. So complementary and alternative services. As the emphasis on holistic health and public awareness often desire for complementary and alternative therapies grow, older adults may seek new or non-conventional types of services. Example of complementary and alternative services including the following. First is wellness and renewal centers, education, counseling, and case management from alternative practitioners, acupuncture and acupressure, Tai Chi yoga and meditation classes, therapeutic touch and healing touch, medicinal herbal prescriptions, herbal and homeopathic remedies, guided imagery sessions, sound, light, and aromatherapy. Nurses possess a wide range of knowledge and skill that when combined with additional preparation in complementary and alternative therapies makes them ideal provider of some of these non-conventional services. Even if they are not direct providers of alternative therapies, nurses can advocate for older adults' right to make informed choices about using such therapies, educate them about the benefits, risk, and limitation of therapies, and help them find reputable providers. So matching service to needs. The needs of the aging population are diverse and multitudinous. In addition, the end of an individual older adults are dynamic. In the words, needs fluctuate as capacities and life demands change. This condition required gerontological nursing services to be planned with consideration of several factors. So services must address physical, emotional, social, and spiritual factors. Service must be available to meet the unique needs of the older population in holistic manner. These services should be planned to address whether problem or needs older adults are likely to develop and should be implemented in a manner relevant to the unique characteristic of this group. Next, services must consider unique and changing needs. Physical, emotional, social, and spiritual services are based on the individual's needs at a given time, recognizing that priorities are not fixed. So, matching services to needed. So, in addition, care and services must be flexible, of course. Opportunities must exist for the older individuals to move along the continuum of care, depending on his or her capacities and limitation at different times. Services must be tailored to needs. Individualization must be practiced to match the unique needs of the individuals with specific services. Settings and role for gerontological nurses. So, because the continuum of care include community-based services, institution-based services, or a combination of both, gerontological nurses have an existing opportunity to practice in a variety of settings. Some of these settings, such as long-term care facilities and home health agencies, have a long history of nursing participation. Others, such as senior housing complexes and adult daycare center, offer new opportunities for nurses to demonstrate creativity and leadership. Although nurses' specific role and responsibilities can differ vastly in different settings, gerontological nurses in any setting may serve similar functions. These functions are varied and multifaceted and address the following goals. So first is educate person of all ages in practices that promote a positive aging experience, assist and provide intervention related to nursing diagnosis, identify and reduce risk, promote self-care capacity and independence, collaborate with other healthcare providers in the delivery of services, maintain health and integrity of the aging family, advocate for and protect the right of the older adults, promote the use of ethics and standards in the care of older adults, help older person face the transition to death with peace, comfort, and dignity. And that's all for our report. Thanks for listening.